New videos every day.
Hello, this is Dr. Echols again, and today we're going to talk about chiropractic and depression. Now, depression seems to be something that's been affecting more and more people over the last several decades. And of course, the medical profession has its way of dealing with these things, and alternatively, the alternative healthcare professionals have their way. One of the things that spurred this video is that I saw a recent study about depression, and I found it very interesting. They took three groups of people, and one group, they gave them psychiatric medications for their depression. The next group of people, they gave them strictly exercise. And then the third group of people, they gave psychiatric medication plus exercise. Now, most people, including the doctors in the study, they expected to see that the people who were on exercise plus the psychiatric medication would do better. But that's not what they found at all. As a matter of fact, they found out that the people who did exercise alone got far better results than those with the psychiatric medications and the exercise. So I've been really reviewing this a lot lately. I'd love to help people who are depressed and see if we can get them feeling better without the use of these drugs, because they all have side effects. And some of them are quite severe. Unfortunately, when you review all of the different tragedies, like the Columbine tragedies and different things like that, all of those people were on psychiatric medication. And one of the labels on the medication is that these drugs can cause homicidal ideation, which means you dream about killing people and things like that. So it can be a very serious side effect. Some of the other side effects of long-term psychiatric medications is that people can develop facial twitches and grimaces and tics that unfortunately are permanent. So some of these young, beautiful women who've been on psychiatric medications for years start to develop these uncontrollable twitches and spasms in the face, and unfortunately by that time they're fairly permanent. So what are some of the things that we can do from a chiropractic standpoint and from a good nutrition standpoint to help with this ever-growing problem? Well, let's look at it from strictly a physical point of view. The spine, of course, goes all the way up to the brain stem, and your brain stem actually extends down into the top vertebra of your spine. It's called the atlas. Any pressure on that brain stem can actually not only affect you physically, but it can affect you mentally and emotionally. If you look in Gray's Anatomy, there's a sheet that shows the effects of spinal misalignment. And if you go and you look at the very top vertebra, which is called the atlas, it shows you where those nerves go that come from there, and they go to the sinuses and the eyes and the brain and back up into the scalp. And then it shows you, if that vertebra is misaligned, what are some of the possible effects of that misalignment. In the atlas, some of the possible effects of that are headaches, vision problems, but also anxiety and depression can be caused by that too. Insomnia. All of these different kinds of problems can be related to a physical problem here. So oftentimes when we start adjusting and taking the pressure off of those, like you've seen me done in past videos, the person's mood can start to get better. They can start to sleep better. They can not have the headaches they were having. Their vision sometimes improves. I've had people report that their night vision improves. So given the severe side effects of some of these medications that we have, and the fact that there's very little benefit in the studies that have been done, I think it may be a wise first choice to try some alternative therapies. Now, we mentioned earlier that exercise was very important, and actually a very ancient therapy for depression was that they would take the person who was even psychotic and they would walk him so far that he would fall down from fatigue. And at that point, they would get him up and they would walk him home. And by the time he was home, he was cured. So we can do a similar technique today, and I just call it take a walk. When you start feeling depressed, get up, go outside, if this is at all possible for you, and just start walking around the block. And keep your head up and look off into the distance and look at the different buildings and the trees and the birds and whatever it is outside of yourself. Don't let yourself get caved down in upon yourself. So keep walking. One of the things that you'll notice is that you'll start to feel a little bit better. At that point, don't quit, because the next thing that'll happen is you will start to get fatigued. And when you get fatigued, keep pushing yourself a little more, and then after that, you'll start to feel very energized, very refreshed, and very light, and your mood will improve. And you won't be so introverted. You won't be so lost in your thoughts. Your attention will be back on your environment where it belongs. Very simple technique that you can use today to help yourself elevate your mood a little bit. Now, one of the other things I want to touch on is I have found in my practice that nutrition is paramount when it comes to depression. People who are just eating junk food are not going to be producing the proper brain neurotransmitters to make their brain function properly. Their body is going to be in a depressed state. Depression is a mind-body problem, and that's why so many times the mental state of the person is dragged down by the physical state of the body. I know for myself, when I am not feeling good physically, I'm not feeling that happy. I may be a little bit depressed or a little down. And I actually recognize now that my body has just not gotten enough rest. I didn't get 4 hours sleep that night. I'm not feeling very good. So when our bodies are functioning really good, it's very hard for us to be depressed. So one of the things that we can do is improve our diet. And we've found that good, healthy fats are absolutely essential to good nutrition and to eliminating depression. Omega-3 fatty acids, very, very important. Our brain is made up of fat. All of the cellular membranes in our body are made up of fat. So we have got to give our body the good fat to make those cellular membranes strong. Also, they're really important in producing the proper hormones in our body so that we can produce the right hormones that keep us on an even keel. When your neurotransmitters in your brain get off, we go back upstream and we look why. We figure out what nutritionally is off. We give that person them. Then the person can start responding appropriately and building the right hormones and nutritional transmitters they need in order to function properly, rather than just drugging them on the back end and leaving them in a chronic state of depression and relying on drugs that may be not so beneficial to them. Getting processed foods out of your diet is very important because so many times those have trans fats in there, which can do damage to our bodies. The cellular membranes get damaged and then cause problems. Another problem with depression, and this is pretty key as well, is blood sugar dysregulation. When somebody's blood sugar is all over the place, they're mentally and emotionally going to be all over the place. So one of the things that you can do is start to avoid sugar, and even artificial sweeteners can cause a lot of problems like that, because most artificial sweeteners actually have an effect on the neurotransmitters of your brain. They're actually neurotoxic, things like aspartame and things like that. So you got to be careful. Even in chewing gum, they put that kind of thing. So we want to eat whole, fresh foods and vegetables. Try to start steering away from preservatives, food dyes, colors, all of which go in and can have a negative effect on our body, drag us down, drag our mental state down. Get outside, get plenty of exercise. You don't have to push it hard. It can be just as simple as taking a simple walk and putting your attention out on the environment like we talked about. Good fresh fruits and vegetables and whole meat. Plenty of omega-3 fatty acids like would be found in tuna or salmon. If you don't like fish, get yourself a good omega-3 oil. Eat plenty of that every day. Vitamin D, very, very important. Take charge of your health. Don't be relying on just medications to try to prop up your mood. The research shows that long-term, even short-term, maybe not that effective. So there are things that you can do. There is something that can be done about it. If you want more information, please look at my website, www.jeffechols.com. And until next time, good day.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.